Dealing with minor injuries at the workplace. Topics to be covered. Topics to be covered in this module: abdominal trauma, allergic reactions, anaphylactic shock, bites and stings, burns and scalds, contusions, bruises, crush injuries, cuts and scrapes, dislocation, eye injuries, extreme cold, hypothermia, frostbite, and so on, extreme heat, heat exhaustion, heat stroke, etc., falls and breaks. Foreign objects, fractures and broken bones, grazes, head injuries, insect bites and rashes, small splinters, spinal injuries. Abdominal trauma. For the most part, pain in the abdomen is usually caused by overexercise or digestive issues. Alarming symptoms such as vomiting or severe stomachache can just be down to mild food poisoning that will eventually pass through the system without long-term issues. However, severe and intense abdominal pain can be a sign of a serious injury from internal trauma or a recent accident. For instance, the life-threatening condition of peritonitis is an infection of the tissue around the abdomen, which can first be recognized by swelling or a feeling of pain or tenderness in the abdomen. This is often caused by intestinal damage or a diseased appendix, which can lead to several dangerous conditions. Therefore, a first aider should take note of the following symptoms: past or present cuts or injuries to the abdominal area, obvious bleeding or bruising around the abdomen, constant vomiting, consistent and sustained pain in the stomach, a casualty being unable to stand straight, and other signs that there may be internal damage. As far as treatment goes, a first aider should contact emergency services in case of dangerous internal damage or an injured organ. The responsibility then lies with them, which are: to keep the patient rested and calm, preferably laying them down in the most comfortable position to deal with the pain, to loosen any ties, belts, or tight clothing, support and keep them comfortable with pillows, blankets, and a hot water bottle if possible. Not to touch any physical wounding or protruding organs, rather cover and protect it with a dressing. Not to let the patient eat, drink, or smoke. To monitor the patient until medical professionals arrive. Allergic reactions, anaphylactic shock. Most of us probably know someone who has an allergy of some kind. This is when the defense system of the body reacts badly to an allergen, natural trigger substance. It might be to a certain animal, cat or dog hair, food, peanuts, dairy products, some plants, hay fever, or a certain situation, bee sting. In most cases, this might cause a mild rash or bouts of sneezing, but it can also result in severe allergic reactions, known as anaphylactic shock, which can be life-threatening. An anaphylactic shock can take hold within seconds or minutes. The severe reaction causes chemicals to flood the body in large amounts, causing blood pressure to drop suddenly, airways to constrict, and the tongue to swell. This can obviously create breathing difficulties and be potentially fatal. If a patient shows signs of going into a state beyond a mild allergic reaction and entering that of anaphylactic shock, then the following steps must take place. Call emergency services immediately and tell them there is a suspected case of anaphylaxis. If the casualty has an allergy medicine or a self-injection dose of adrenaline, then help them to take it, or give it to them if you are trained to do so. Sit them up and put them into the best position to breathe easily. If they become faint or pale, lie them down with their legs slightly raised. Monitor their status until an ambulance arrives. Further doses of adrenaline can be given after every 5 minutes. Keep them as calm and comfortable as possible. Bites and stings. Animal bites can puncture the skin, damage the tissue, and instantly cause infections. If this occurs in an area where rabies is active, antiviral treatment will be needed from emergency services. From a first aider's point of view, the wound will need to be carefully cleaned and dressed as per usual cuts or injuries. An insect sting is usually just painful or irritating, with swelling and soreness being the worst effects. However, if a person receives multiple stings or is allergic to the insect, it may lead to an anaphylactic shock or a serious reaction. A sting near the airways could also cause swelling and breathing difficulties. When treating a sting, remove the stinger carefully, brushing it away with a flat surface or fingernail. Do not pick or squeeze the area, as it could result in further venom being released into the system. Apply an ice pack or cooling material for 10 minutes to keep the swelling down. Keep a close eye on further allergic reactions and contact the emergency services if the patient starts to go into anaphylactic shock. Whilst venomous animals are in short supply in the UK, stings or bites from some other animals may need specialist treatment. Snake bites will always require hospital treatment and identification. Ticks need to be carefully removed with tweezers. However, in all cases, the bite or sting should be cleaned, cooled, dressed, and the patient monitored. Burns and scalds. A burn or scald can be caused by a large variety of sources. It can come from radiation, sunburn, etc., dry heat, fire, hot surfaces, etc., extreme cold, freezing components, etc., chemicals, acids, etc., electricity, cables, etc. A burn can be categorized into 3 different levels. First-degree burn, superficial burn, where just the top layer of skin has burnt. The skin will be red and irritated and highly painful. Second-degree burn, partial thickness burn, where a thicker level of skin has been damaged and there is a greater chance of infection. The skin will be red and swollen, and blisters will be present quickly. Third-degree burn, full thickness burn, where all layers of skin and nerves have been burned away, and there is a huge chance of infection and shock. The skin will be charred and stiff to move. For first-degree burns, remove the casualty from the source of the burn or scald. Wear protective gloves and then cover the burnt area with cold water. Remove everything from the burnt area unless it is stuck to the skin, in which case leave it. Cover the injury with a medical dressing or cling film in an emergency. Contact emergency services immediately if the burns cover more than 5% of the body or the patient has gone into shock. For second-degree burns, if caused by electricity or another dangerous source, make sure this is no longer a risk before moving them from it. Follow the same procedures as with first-degree burns. Do not disturb or burst any blisters that may be forming. Dress and cover the wound as per normal. Emergency services will be immediately required if the burn covers more than 1% of the body. For third-degree burns, follow all the previous guidelines from first and second-degree burns, but take extra care when moving limbs or dressing the body. The blisters must be left intact, as well as the clothes that are stuck to the skin. If chemical burns have taken place, flush the skin or eyes with as much clean or cold water as possible. Emergency services should be contacted straight away. Contusions, bruises. A contusion or bruise occurs when a person experiences some kind of impact in an accident or is gripped by machinery or another individual. They are not normally indicative of a serious injury, but incidents can arise when they provide early evidence of a more serious problem. The contusion or bruise happens when blood vessels at the surface of the skin are ruptured or crushed by force. This releases some blood, which forms under the skin as an easily recognizable dark patch and possible swelling. Each bruise will darken from an immediate red color to a deep purple or blue over the course of 2 to 5 weeks as it heals. The treatment that a first aider can give to a casualty that has severe bruising or contusions is mainly to alleviate the associated pain and swelling. First aid applied correctly can help bruises heal quicker. To treat the patient, place a cold compress or ice pack gently on the bruised area. This will dull the pain and minimize swelling. To stop any further swelling on the arms and legs, the limb may be raised slightly, as long as the casualty is kept comfortable. Be aware that bruising could point to further serious injuries, and a first aider should alert emergency services of any suspicions. Crush injuries. A crush injury occurs when a casualty's body or limbs are subjected to above normal pressure between two solid objects. Crush injuries are usually associated with construction or demolition sites, warehouses, and road accidents. The most serious form of injury will affect the blood circulation to a limb or main organ. If a heavy weight traps toxins in a certain area, it can have fatal consequences. There are 2 types of serious crush injuries. Compartment syndrome. This describes an injury where tissue and muscles are crushed. It mainly occurs on building sites, industrial sites, construction areas, storage warehouses, and in road accidents. The damage and lack of oxygenated blood will rapidly cause tissues to die and could cause the loss of a limb or irreparable organ damage. Crush syndrome. The risk comes from released pressure on the muscles following an incident, which can then cause a rush of built-up toxins to flood the body and cause kidney failure and shock, which can then cause a rash of built-up toxins to flood the body and cause kidney failure and shock. If the blood flow is restricted or impaired for more than 15 minutes, toxins can be released into the rest of the body, causing kidney failure. This process is called crush syndrome, and the patient is at high risk of death. To treat the victim of a crush injury, A first aider should only approach when the surrounding area is safe. Then, immediately check how long the casualty has been trapped for. If they have been stuck for more than 15 minutes, do not attempt to move them. This will prevent the onset of crush syndrome. Emergency services must be contacted. If they have been trapped for less than 15 minutes, they can be moved and treated with basic first aid as appropriate. Treat cuts and wounds as per normal and limit the bleeding. Be prepared to perform CPR if necessary. Cuts and scrapes. Arguably the most common form of workplace injury, minor cuts and scrapes are more irritating and painful rather than life-threatening. However, first aid can still prevent serious infection from setting in. A minor cut to the skin can be caused by anything slightly sharp, even a leaf of paper in a notepad. A scrape can result from rubbing against a rough surface of some kind. It can remove large sections of surface skin and expose nerve endings, with possible bleeding and infection. In both cases, however, the first aid treatment is basic and familiar. Wear gloves to minimize infection. Look for any foreign material in the wound, glass, gravel, and so on. Clean the wound accordingly, preferably with a sterile wipe or clear water. Apply direct, gentle pressure if bleeding persists. Cover with sterile dressing and monitor for any infection. Dislocation. A dislocation is an injury to a joint where the ends of connecting bones have been forced out of their sockets or normal position. This can be extremely painful for the casualty and makes use of the affected limb impossible. They can often occur during contact sports, bad falls, or with children during play. Dislocations can occur in any joint, including knees, hips, elbows, shoulders, and fingers. If this injury has occurred, it needs to be reset back into place by qualified medical personnel. Unless a first aider has had the necessary training, they should not attempt to move the dislocated bone back into place. It can severely damage ligaments, nerves, and other parts of the body. If you suspect a dislocation, emergency services should be called whilst you wait. Put an ice pack or cold compress carefully against the area to stop further swelling and ease the pain. Give the casualty ibuprofen and other over-the-counter painkillers as appropriate. Keep them calm and comfortable. Eye injuries. Eye injuries can be as simple as irritation from fluids to a cut or foreign object damaging the eyeball. The worse the injury is, the more chance that a patient's vision may be permanently affected. The most numerous types of injuries will involve blows to the eye from sudden contact with an object, such as in football or boxing or a comparable accident. Foreign objects becoming stuck between the eyelid and eye or on the eye itself, such as an eyelash, grit, and so on. Grazes or cuts to the surface of the eye during an event, such as broken glass, and so on. Whereas some injuries can be solved by merely rinsing the eye with clean water, if there is any suspicion that there's been damage to the surface of the eye, emergency services must be called, or the casualty should be taken to hospital for a full checkup. Fluid or blood leaking from the eye is usually a sure sign of this. A first aider can treat an eye injury in the following way. If the cause isn't immediately obvious, Open their eyelids gently with your thumbs and examine the eye under strong light as they look around the room. If you can see the small foreign matter, flush it away with clean water washed from the corner of the eye. If the injury is due to a bruise or cut, get them to lie back and keep still. Apply a dressing and/or a protective pad over the damaged eye to protect it. Do not attempt to remove any large object from the eye. Call emergency services immediately.